Hello, this is Dr. Gay, and this is a patient who has had a transient patellar dislocation. Their kneecap, or patella right here, has popped out and came back to normal position. So to get oriented, this is the kneecap in the front, this is the femur behind it, this is the back of the knee, this is the inner side, and the kneecap has popped out. We call it dislocated, and we know that because if we come down here a little bit lower, we see a bone bruise. This foggy bright area is where the kneecap impacted. It slipped out, impacted right here, made a bone bruise, and it jumped back to normal position. Most of the time there's an injury of the kneecap right here at the patellar apex or medial side over here. In this patient, they just have the bone bruise out on this side. We also know that the patella is abnormal in position. It's subluxed laterally a little bit, slipped laterally, and it's also rotated. We call this lateral patellar tilt. This patient has a patellar tracking disorder where there's lateral rotation or tilt and lateral subluxation. And we also see that in the very front here, this is where the kneecap should be. The kneecap is a little bit too high, and the front here, this trochlea, the front of the femur, is really shallow. Instead of having a deep groove, a deep V, it's more horizontal in a sort of a shallow groove. And when that happens, the kneecap is unstable. And instead of sitting comfortably and stably in a deep groove, it's more prone to slip out. In this case, again, it's a high-riding patella that has lateral subluxation, lateral rotation, lateral tilt. And again, we see that it has dislocated, and we have the evidence right here to prove it, this bone bruise. I'll show you one other view, the opposite knee. But first, I'll start with a normal knee here. This is the kneecap, normal position. If we go down here, we have a little bit deeper groove. There's no bone bruise out here on the lateral side, and there's no injury of the patella. Now we're going to go to another view. I'm another patient, and I put arrows on where the bones have impacted. So this is the kneecap here. It's subluxed laterally this direction. The trochlea is very shallow instead of a deep groove. And we see this bony defect here, the patellar apex. This is the apex of the patella, and it's irregular. There's marrow edema, so a pretty significant impaction injury. And you see here the lateral femur is also very bright and foggy, a really prominent bone impaction injury. And we see the bone is caved in a little bit. This is a cortical impaction and underlying marrow edema. So the kneecap popped out, hit here really hard, and popped back into position. And we have the two areas, the kissing contusions, the patellar apex and lateral femoral condyle. And again, you can see how the cortex is impacted inwards, caved inwards a little bit. Very common injury. Sometimes they'll shear off little pieces of cartilage or bone from the patellar apex, and they can have other injuries along with it. And that's it, transient patellar dislocation.